Finally, in the audit process, you'd think about what are we going to do? What kind of actions are we going to take? So an audit isn't over once the charts are reviewed. And the next step is just as important. It's reporting the results and taking action internally to improve. So this is where we got to provide feedback for your team. What are the areas for improvement? What are the strengths? What did you do really well? I love to, when we do audits, I love to say, hey, listen, you guys are doing awesome. Like, there's not a lot I can change, but this one thing that you change, one, it's going to protect you, but two, it's going to allow you to generate a lot more revenue. And so that's really important. What training and support are you going to provide your providers who do need to improve? Hello and welcome to Chris Wolfe Podcast on iCode Media. Today, we're going to dive deep into a topic that might not sound glamorous at first, but I guarantee it's important when it comes to your practice's success. We're going to talk about chart auditing, compliance, patient care, profitability. Before you hit pause or delete altogether, this is all not just about compliance and paperwork. It's not. It's really about articulating the complexity of the care that you provided to the patient. And ultimately, I look at it like a way for us to care better for the patient. Think about, how do we care for our patients? How do I make sure I can provide all the services that I want to provide for that patient that they need primarily, and then not have to worry about if I'm going to get audited or I'm going to have to pay the money back or how many times can I bill something. I don't want to worry about that. I just want to do the right thing for the patient. And documentation allows me to do that. It means I don't have to worry about if a patient goes south, right? Like, what kind of documentation do I want to have in a scenario where a patient has a bad outcome? I want to know that I did everything that I'm supposed to do by our clinical practice guidelines, by preferred practice patterns, and then I want my chart to reflect that. So even in the case of like a medical legal problem, right? I know my documentation is good. Chart auditing allows us to do that. It is not just about billing. It is not just about compliance. It's really about supporting the level of care that we provided for our patients. So super important, I think. So we're going to walk through the steps of an effective audit process and how to make that work for you and how you can actually improve your bottom line. So please stick around to the end. As always, be sure to subscribe to the podcast, write a review, share it with your friends, and support those who support us. The most common questions I get include, what ophthalmological codes or evaluation and management codes should I use? What ICD-10 codes do I need to bill with this CPT code? What CPT codes can be billed together and what can't? And my favorite, how do I manage a patient who has diabetes who comes in for a quote-unquote routine eye exam? These questions really highlight the confusion and uncertainty that serves as a daunting hurdle for providers, makes it more challenging for them to care for their patients and provide those patients with the best opportunity for a lifetime of ocular health and clear vision. That's why we built iCode Education, for this specific purpose. Our mission is to provide optometrists with resources to help you understand disease states, revenue cycles, and billing and coding so that you can put that on autopilot and truly care for your patients. Check out iCodeEducation.com. That's EYECODE education.com. We've developed a premier billing and coding bundle that includes all of our billing and coding resources in one place. We also have a 10% discount code just for listeners of this podcast. Enter the coupon code EYECODEMEDIA22 at checkout. We'd love to work with you. Check out iCodeEducation.com. Hello, dedicated optometrists. Are you looking for a way to support your patient's vision and overall eye health? Let me introduce you to Vision Edge Pro, a visual performance supplement that stands out in our profession. Vision Edge Pro contains a balanced blend of mesozeaxanthine, lutein, and zeaxanthine in a 10-10-2 ratio. This combination has been scientifically shown to increase macular pigment density, which enhances visual performance, including contrast sensitivity and vision in glare situations. Additionally, Vision Edge Pro provides 300 milligrams of DHA and EPA, fulfilling the daily requirements for omega-3s as recognized by the leading health organizations. This ensures your patients receive the essential nutrients their eyes need for optimal health. Whether it's for everyday screen use, night driving, or enjoying the outdoors, Vision Edge Pro supports your patients in seeing their best. Recommend Vision Edge Pro for your patients today and help them achieve clearer, healthier vision. Contact your local MacuHealth representative for more details. Vision Edge Pro, because your patients deserve the best in eye health. Go to MacuHealth.com and use the coupon code PODCAST2024 at checkout for special discounts. So let's start with why, as always. Why do we audit charts? If you're like most of us, most doctors, you're probably thinking, I don't need another thing on my plate to do. I've got a lot of patients. I've got other HR things I've got to worry about. So here's the reality. Charts audits are essential for these three reasons. First and foremost, patient care. Good documentation leads to better patient care, and audits help us identify gaps in our clinical documentation. And in many cases, it will even allow us to see where we can improve our decision-making and patient outcomes. Because now we're looking at it with another critical eye, or if you're looking at it with a trusted colleague, then that trusted colleague might be able to make recommendations like, hey, I noticed that this happened, and have you looked at the new guidelines on this, or the new clinical practice guide, the preferred practice patterns on that, or have you seen this new study related to that? So I find that really helpful when people come in, and I have them do that for my practice as well. Number two, compliance. We operate in a heavily regulated industry. Medicare, Medicaid, commercial payers, they all have their own rules, and those rules can change at any time. And so regular audits obviously ensure that our documentation keeps us in compliance with these ever-evolving standards. And then revenue integrity. Number three, revenue integrity. If you're not documenting correctly, you're likely leaving money on the table. In our experience, if you're an optometrist, you're likely leaving a lot of money on the table because you're often worried about overcharging or overbilling because you haven't really thought and looked at your documentation to know confidently that you have met those specific requirements. And so it directly impacts your practice's financial health. And I would argue that over time, the more that happens, the less value you see inherently deep down in your brain without actually the cognitive effort of it. But when we feel like something isn't valuable to our practice because we're not charging appropriately for it or billing appropriately for it, then oftentimes we have an incentive or a little drive to maybe not do it as much. And I don't think that's conscious. I actually don't think that's a conscious thing that happens, but it's something we should be aware of that happens in the back of our mind that says, boy, if I just didn't provide as much of this care and I could maybe provide a little bit more of this care, because we're not comparing apples to apples in terms of dollars, revenue per OD hour, and you've heard me talk a ton about that on this podcast, then kind of weird things happen in our brains, and that changes some of our behaviors. So I think it's really, auditing can actually help us maintain good habits and good behaviors that primarily allow us to do better care for the patients. So what does a good auditing process look like? I want to break it down step by step. First, you want to prepare for the audit. As always, preparation is key, and you got to have a clear plan for what you're auditing and why you're auditing. So are we auditing specific CPT codes? Are we going to look at certain providers in our practice? Are we going to look just at certain types of visits? So are we going to look at just office visits? Are we going to look at comprehensive exams? Are we going to look at special testing? Know what you're looking for. Think about the areas that you're most vulnerable in your practice. Probably, I would say that one, it would be the areas that you do the most of, right? So if I do a ton of comprehensive exams and I do a lot of routine eye care, those routine services, those routine payers, most of the time have a checkbox. And I'll tell you, a lot of us, and those checkboxes aren't even laid out in CPT. So CPT gives us a more general requirement for a comprehensive exam than many vision payers will. And so some vision payers will be as granular as the types of binocular testing they want to see. Well, if they're asking for one of those things and you're not doing one of them, they can come back and recoup all that money or downcode it for you. So no, is it that we're doing a lot of those specific types of services? Or is it a service that I want to do more of, but I'm uncertain of? Or even, did I get a new piece of technology that have incorporated into the practice and I'm billing a whole lot of, but I'm doing it largely because I thought, wow, this is going to be good for these types of patients, but I'm kind of stretching a little bit. So how am I documenting those cases? Maybe when I say stretching, I'm not saying stretching in the sense of doing something wrong. I'm saying, did my documentation clearly articulate what I was concerned about and what I was finding? Or did I just realize that I'm concerned because I think about it as this code, and I know this code can get paid with this test, and so I'm just going to do that test every time I see that patient who has that code. And then I haven't documented it well. So those are the kinds of things I would think about and I would look at when preparing for an audit. There's two ways to approach audits. So, are we going to do an internal audit or an external audit? Internal audits are done obviously by somebody in your own team. There might be another doctor or your biller, and you might, it might be yourself, and you're just going to pick through what you do. I'd be really cautious with internal audits because, if you're making a mistake on the initial audit, then how are you going to avoid that same mistake, or on the initial documentation? How are you going to avoid that same mistake again when you're reviewing it? Are you having a checklist that now all of a sudden is done that in a way for you to kind of walk through to make sure what you're looking for is correct? So I'd be really, I think internal audits can be good, but you have to know what you're looking for, and you have to know that what you're looking for might be different than what you actually did. And if you were the one that was actually doing in the first place, and now you're doing the review, if you make a mistake in each case, you're not going to catch the things that you otherwise should catch. External audits, on the other hand, bring a fresh set of eyes and should bring a set of expert eyes into your documentation that can catch your blind spots and hopefully can also bring other perspective related to clinical practice, right? So obviously we pride ourselves a ton at iCode because we are clinicians. It's not just that I was a clinician for a while ago and now I don't practice anymore. I am in patient care the majority of my week. And so you want somebody like that. I'm not saying it's me, but you want somebody like that who doesn't just look at the regulations, but also really deeply understands the regulations, but also deeply understands clinical practice guidelines, preferred practice patterns, so that they can maybe make some other recommendations based on documentation. But maybe, hey, did you think about this? I'm noticing that you have a lot of patients that you document this on. Have you seen this new piece of literature, or have you seen the new preferred practice pattern, clinical practice guideline related to this? That can be really helpful. I find that really helpful when we do external audits in our practice. CooperVision and the AOA have joined forces in a groundbreaking initiative to transform how optometrists treat children with myopia. The Myopia Collective aims to unite our profession and its allies to challenge the status quo and elevate the standard of care for children with myopia. Everyone is invited to become a member of the collective. By joining, you pledge to act in slowing childhood myopia progression. Membership includes regular updates and information about the collective's efforts, access to educational opportunities and resources, and insights from the ambassador optometrists who advocate for community policy and changes supporting the collective's mission. Click the link in the show notes to join the collective today. We've been partnering with EssilorLuxottica 360 for a while now, and it helps us in 3 areas. First, they use social media campaigns to highlight products that we believe in and prescribe to our patients, and they deliver those patients back to our practice. Second, EssilorLuxottica 360 enhances our patient experience through staff training tools that help us simplify and streamline the way we communicate about our products and services. Lastly, but for my practice most importantly, it helps us make good business decisions related to our optical offerings. We will systematically and objectively analyze what our patients are purchasing and what they like, and removing products that our patients are not really using or not really drawn to. This, along with additional rebates and immediate savings, helps us continue to deliver high-quality products and services to our patients and keeps our practice resilient. Check out EssilorLuxottica 360 for yourself by visiting EssilorLuxottica360.com. During the audit itself, do you want to evaluate both the coding accuracy and the documentation? You want to do both of those things. So you want to make sure that you're using CPT properly. You want to make sure that you're using the correct ICD-10 codes that are describing the situation as clearly as possible, and then also linking the correct CPT codes to ICD-10 codes. I mean, it happens way more often than you'd think, where people just aren't getting paid, and the payer thinks, well, this isn't getting paid, but or excuse me, not the payer, but the biller who's submitting in your office might come back and say, hey, or they might even just write it off because the payer says it's not useful for that ICD code, and you might not even ever know it. And it's just that maybe the H40123 got billed with an optic nerve OCT instead of H40.013, right? Very common. You know, if a patient has dry eye and a glaucoma, as a glaucoma suspect, it's easy to see those codes similarly and have one code, if you're not paying attention, go with something that is not going to be paid. So just looking for things like that. Medical necessity. Are you documenting the medical necessity for specific tests? Are you providing signatures and dates? Are you actually finalizing your charts in the EHR? Are there clear follow-up instructions? Are there clear documentation to initiate medications or continue medications? Those are areas that I think are really important. One of the big ones is really thinking about focusing on medical necessity. You know, does your documentation tell the true story of what the patient needed from you on that day? If your notes don't clearly paint that picture, you're at risk during an audit. And then finally, you know, in the audit process, you'd think about, what are we going to do? What kind of actions are we going to take? You know, so an audit isn't over once the charts are reviewed. And the next step is just as important. It's reporting the results and taking action internally to improve. So this is where we got to provide feedback for your team. What are the areas for improvement? What are the strengths? What did you do really well? I love to, when we do audits, I love to say, hey, listen, you guys are doing awesome. Like, there's not a lot I can change, but this one thing that you change, one, it's going to protect you, but two, it's going to allow you to generate a lot more revenue. And so that's really important. What training and support are you going to provide your providers who do need to improve? So let's think a little bit about another question I get asked all the time, which is auditing worth the time and effort? And my answer is absolutely 100% yes. Here's why. First, better about documentation, I believe, as I've stated before, leads to better patient care, better patient outcomes. And better patient outcomes and better documentation leads to better compliance, which reduces your risk of audits by payers, and it also reduces your risk of anxiety. You can go home at night knowing that your charts are done, you've done a good job. If something happens, you don't have to think about it anymore. So that documentation ensures you're capturing the revenue you deserve. And I want to give you an example. You know, one practice, not just one, but practices I work with all the time. But this specific practice, and you've heard about them on the podcast before, but we worked with and implemented a regular auditing process, and we found that they were underbilling by thousands of dollars just in 1 month. Thousands of dollars, and simply because they weren't documenting visits appropriately, and they were downcoding their visits, and they weren't documenting the tests they were ordering or billing those tests appropriately. So just fixing those gaps paid for the time that they spent on their auditing many times over, not just for 1 month, but month after month after month. So what I want to do is I want you to think about how you're going to approach your auditing. If you want to do it on your own, do it on your own. There's there's resources we have at iCode that can give you a sheet that can break down what you're thinking about. But you can also reach out to us so we can provide you with some of these chart auditing services. And so within our chart auditing service, you're not just getting someone to check your charts, you're getting a comprehensive audit process with actionable feedback on your documentation, training and support for your providers, ongoing auditing to ensure you're on track. And so in our complex reimbursement environment, if you want a partner to help you maintain integrity and accuracy in your medical records, we can help you with that. It's not just about avoiding penalties. It's really about helping you provide the best care for your patients, ensure you're getting paid appropriately, ensure you're not going to have to worry about failing an audit. To wrap up, remember, audits aren't something you got to fear. They're something you can embrace. They protect your practice, improve your patient care, ensure you're capturing the revenue you've earned. I hope this was helpful. Thanks for tuning in today. Don't forget to share this episode with your colleagues. Leave us a review. And as always, if you have any questions or need support, please feel free to reach out. Talk to you soon. Have a great week. See ya. Hey, if you enjoyed this episode, make sure to subscribe to us on Apple Podcasts and our YouTube channel, both linked in the show notes. Now, here's something exciting. We're giving away a 1-year subscription to Comprehensive Optometry Simplified. All you have to do is leave us a review on Apple Podcasts, take a screenshot, and email it to me at questions@icodeeducation.com. We'll put that in the show notes as well. We'll be selecting a winner on December 15th, so don't miss your chance to get access to this valuable resource. Thanks again for listening. I can't wait to see your reviews.